This article, titled Fluoroscopy-guided fine needle aspiration of deep-seated pulmonary masses in dogs and cats appears safe and accurate, delves into a minimally invasive technique for diagnosing pulmonary lesions in our furry companions. Solitary pulmonary lesions are a somewhat common occurrence in dogs and cats, and determining their nature, whether benign or malignant, is crucial for making informed treatment decisions. While techniques like transthoracic ultrasound guidance, tracheobronchoscopy, and CT guidance are available, they each have limitations, particularly when it comes to sampling deep-seated lesions. This is where fluoroscopy-guided fine needle aspiration, FGFNA, comes into play. The objective of this study was to investigate the safety and accuracy of FGFNA in sampling deep-seated pulmonary lesions, regardless of their size or location within the lung. The study involved a total of 10 client-owned animals, 5 dogs and 5 cats. Before the procedure, the location of the pulmonary lesions was pinpointed using fluoroscopy. The lateral chest wall was then prepped for the procedure, and an indelible marker was used to mark the precise spot where the needle would be inserted. A 22-gauge needle attached to a syringe was guided into the lung using continuous fluoroscopic visualization. This real-time imaging allowed for precise needle placement and minimized the risk of complications. Measurements were taken to document the volume of the mass, VMA, as well as the distances from the skin to the lesion, DSKL, and from the pleura to the lesion, DPLL. The results of the study were quite promising, supporting the hypothesis that transthoracic FGFNA using a 22-gauge needle is both a safe and effective method for diagnosing deep-seated pulmonary masses in dogs and cats. In the canine group, the average mass volume was 137.2 cubic centimeters, with a range of 6.3 to 426.2 cubic centimeters. The average distance from the skin to the lesion was 71 millimeters, and the average distance from the pleura to the lesion was 33 millimeters. Cytology results revealed carcinoma in 4 dogs and lymphoma in 1 dog. Only one minor post-procedural complication was observed in this group. In the feline group, the masses were notably smaller, averaging 2.4 cubic centimeters in volume. The average DSKL was 42 millimeters, and the average DPLL was 21 millimeters. Cytology results varied in the cats, showing pulmonary carcinoma in 2, inflammation in 2, and necrotic debris in 1. Importantly, none of the cats experienced any post-procedural complications. Figure 1 within the article provides a visual representation of the FGFNA technique. It depicts a solitary pulmonary lesion being targeted with a needle under fluoroscopic guidance. The image clearly demonstrates the ability to track the needle's path in real time, ensuring accurate sampling. Table 1 offers a detailed overview of the 5 dogs included in the study. It lists their presenting clinical signs, pulmonary mass volume, sampling distances, DSKL and DPLL, complications, and cytologic diagnoses. The table highlights the variability in mass sizes and locations, as well as the overall safety and diagnostic success of the FGFNA procedure in this group. Figure 2 presents a compelling case of the procedure's impact. It displays radiographic images of the pulmonary mass in dog 5, both before and 24 hours after FGFNA. The comparison reveals a noticeable change in the radiographic density of the lesion, indicating a response to the procedure. Table 2, similar in structure to Table 1, provides a comprehensive overview of the 5 cats in the study. It outlines their presenting clinical signs, pulmonary mass volume, sampling distances, complications, and cytologic diagnoses. The table underscores the relatively smaller size of the lesions in cats compared to dogs and the absence of any complications in this group. The study's findings align with a growing trend in veterinary medicine toward minimally invasive diagnostic and treatment techniques. FGFNA offers a safe and accurate alternative to more invasive procedures for sampling deep-seated pulmonary masses. The real-time imaging provided by fluoroscopy minimizes the risk of complications and improves sampling accuracy. While this study involved a limited number of patients, the results are promising and suggest that FGFNA can play a valuable role in the diagnosis and management of pulmonary lesions in dogs and cats. Further research with larger sample sizes is warranted to solidify these findings and fully assess the technique's accuracy, especially in feline patients. The authors emphasize the importance of correlating cytologic diagnoses with histopathologic results whenever possible to ensure the accuracy and reliability of FGFNA. This is particularly important in cases where cytology alone may not provide a definitive diagnosis. The study also highlights the need for further investigation into the potential benign nature of solitary pulmonary nodules in cats. The surprisingly long survival times observed in some cats with non-diagnostic or inflammatory cytology results raise questions about the aggressive nature of these lesions in all cases. Overall, the study presents FGFNA as a valuable addition to the veterinary toolbox, providing a safe and effective means of obtaining diagnostic samples from deep-seated pulmonary masses. Its minimally invasive nature makes it a particularly attractive option for patients who may not be candidates for more invasive procedures. From Vet NeuroJar, keep those minds inspired, hearts light, and tails wagging.